Okay, we're going to move on to HB 1570. Representative Lundstrum, you're recognized to present your bill. Did you want someone to come to the table?
Yes, sir. I have some witnesses here.
Okay, if they would come to the table. Okay, if you would introduce yourselves and who you represent.
Sorry. Joseph Backholm with Family Research Council.
My name is Kendall Wagner. I'm an internal medicine pediatrics physician in Fort Smith, Arkansas.
My name is Billy Burleigh, and I'm not affiliated with anyone. I represent myself.
Thank you. Representative, you're recognized to present your bill.
Thank you, colleagues. This bill prohibits sex change procedures on children. This bill protects children in Arkansas from gender reassignment procedures, including puberty-blocking drugs and sex reassignment surgeries. I want to be very specific. The World Health Organization, United Nations Population Fund, and the American College of Pediatricians, and a long list of other organizations have clearly stated that genital mutilation is universally recognized and condemned. I want to protect children, and this bill simply states that anyone under 18 in Arkansas is to be protected. I've brought with me some very special people today. Each of them has an incredible resume, and they have introduced themselves, but I think it's important that you know that not only do they have an incredible resume, they can back it up. So when each of these people speak, I would like for you to listen to what they have to say. And also feel free to ask questions. They have come a long way. Billy's come from California. We've got folks from Texas. Take advantage of the knowledge that they bring to you today. I'd like to.
Thank you, Mr. Chairman. Members of the committee, again, my name is Joseph Backholm. I'm an attorney and a senior fellow with Family Research Council. Gender dysphoria is a real and challenging medical condition. Those who experience it deserve our compassion and respect. But today, we are here because gender dysphoria and the concept of transgenderism more broadly is now much more than a medical condition. It is also a social and a political phenomenon. The recent increase in those claiming to be transgender can only be described as astronomical. In most Western countries, teenage girls seeking treatment have increased somewhere between 1,000% and 5,000%. A Gallup poll released in February of this year found that the percentage of those in Generation Z who identify as transgender is 9 times higher than Generation X or baby boomers. A Brown University study found that referrals to transgender treatments centers had grown 2,000% in 7 years. The same study found that among transgender teenagers, more than 1/3 of them had friend groups that were comprised of 50% transgender youths. This is more than 70 times what would be statistically expected. This phenomenon is known as rapid onset gender dysphoria. It is not only a cultural phenomenon, it is also now a business. Hundreds of new clinics exist exclusively to help people look like the opposite sex. Planned Parenthood, more famous for being the nation's largest abortion provider, now claims on its website to be the second largest provider of cross-sex hormones in America. In a recent interview, a former Planned Parenthood employee described their interest in cross-sex hormones this way, quote, "Trans-identifying kids are cash cows, and they are kept on the hook for the foreseeable future in terms of follow-up appointments, blood work, meetings, etc., whereas abortions are hopefully one-and-done situations," she said. According to that same employee, the decision to provide cross-sex hormones to minors at the clinic where she worked was being made by a clinic manager who had no prior medical experience and whose previous job was managing at Wendy's. However, even if the treatments are provided by medical professionals, they are experimental. There are no randomized clinical trials on the use of cross-sex hormones for these purposes. But there are known risks. Those risks include blood clots, cardiovascular disease, high blood pressure, diabetes, and more. Beyond that, interfering with puberty will always have an impact. You can't pause normal development without lifetime ramifications. Even if puberty resumes, they will be shorter, smaller, and generally less developed than they would be otherwise. Compounding the risk of these treatments is the fact that puberty blockers have not been found to improve mental health. One early 2010 study reported, quote, gender dysphoria did not resolve as a result of puberty suppression, end quote. A more recent 2018 study reported that, quote, our psychometric data suggests the impact of puberty blockers on reducing psychological difficulties is limited, end quote. In the same way, surgical interventions do not show long-term benefits. Suicide rates, psychiatric morbidities, and mortality rates, remain markedly elevated after gender reassignment procedures have been performed. The most thorough follow-up of sex reassigned people, a Swedish study extending over 30 years, found that 10 to 15 years after surgical reassignment, the suicide rate of those who had undergone sex reassignment surgery rose to 20 times higher than the rest of the population. Birmingham University in England reviewed more than 100 studies of post-operative transsexuals. The conclusion, as reported by the Guardian newspaper in England, was, quote, none of the studies provides conclusive evidence that gender reassignment is beneficial for patients. The inability to prove a benefit from surgically or chemically altering your sex is why the Obama administration in 2016 refused to pay for it under Medicaid. Despite receiving a request that its coverage be mandated, they refused, citing a lack of evidence that it benefits patients. This is undeniably a challenging topic for everyone involved, but given the irreversible damage and the lack of benefit these treatments provide, the SAFE Act is a reasonable and necessary response. The alternative is a future in which thousands of former children look at themselves with regret and wonder where all the adults were. Thank you for your time.
Thank you to the committee for allowing me to. Thank you to the committee for allowing me to come in and speak to you today. Really wanted to present my approach as a primary care physician and how I approach this topic and how I interpret some of the terms that you will see in the bill and that you will hear regarding the topic. I'm internal medicine pediatrics board certified in both. I have a majority of my patients are adolescent and pediatric medicine. So I deal with teenagers and adolescents who are going through these types of situations in my practice. And starting with some terms to identify, first of all, I would say biological sex refers to male versus female as determined by sex hormones, gonadal structures, non-ambiguous genitalia, both internally, externally, and then also the congenitally determined sex hormones that a individual produces, as well as their reproductive capacity can go into that term. Gender identity is a term that is more a subjective, psychological term that is referring to the self-perception or self-identification with male or female characteristics. And so that can help us form this discussion a little bit. Gender incongruence. I look at that as where there's incongruence between one person's biological sex and gender identity. So that we may also refer to that as their experienced gender is another way that we approach that topic. Gender dysphoria is actually a medical term, and it's defined by the American Psychiatric Association. You can find it listed in the DSM-5, which is the diagnostic manual for the American Psychiatric Association. And basically, this is the status of gender incongruence that is associated with significant stress or impairment in social, school, and other important areas of function. So you may have incongruence, but it becomes what we would consider a disease when it causes causes distress in the individual who is experiencing that incongruence. And then finally, transgender. It's a broad spectrum of individuals who identify or experience a gender other than that is associated with their biological sex. If you look at the burden of disease for gender dysphoria, and that's where I really want to focus that description, 40% of these individuals have attempted suicide in their lifetime. That's 9 times greater than the U.S. average. In 2015, this was published in a 2015 U.S. transgender study produced by the National Center of Transgender Equality. Rates have persisted into adulthood. So if you look at how many people who have gender incongruence or gender dysphoria in prepubertal or adolescent stages, there's somewhere between 2 to 30% of biological males who persist with that incongruence into adulthood, 12 to 50% of biological females. In a meta-analysis of 10 studies that was actually published in the International Review of Psychiatry in 2016, identified that approximately 85% of gender dysphoric children experience remittance of their dysphoria around or after puberty. So basically, these children were no longer incongruent between their biological sex and their gender experience at that point in time. So there was a large number of these children who develop on into out of incongruency. Gender transition is a term where we describe a process of where a person experiencing gender incongruency changes their appearance or self-presentation from being consistent with an individual's biological sex to being more consistent with the individual's experienced psychological gender identity. And there are a few things that can be involved in this process. The first one is identified as social transition. This may involve changing a person's name, their clothing, their hairstyle, changing their public self-identification, and usually with the request and desire that others affirm this public identity. Moving beyond that, there are medical procedures or medical interventions that have been used in gender transition. One is puberty blockers, which we'll talk about today. These are supplemental hormones that basically prevent a prepubertal child from progressing through puberty and through puberty physical changes. There's also cross-sex hormone supplementation. Essentially, this is providing the different hormones that are not congruent with biological sex to the individual with the gender identity concerns. I'm sorry. Okay. And I think that we'll move on to, I think we moved on to the next person. Okay, perfect.
Excuse me just a minute. Committee, there's some handouts that are coming around for you. Go ahead.
Okay, thank you, sir. I appreciate you guys passing out the handouts. Moving to one of the slides that you are seeing, I'm going to hold up this one because it's a little bit bigger. I apologize. We don't have a screen to present. In puberty blockers, you can see that puberty blockers are used to block gonadotropin releasing hormone. That actually functions right here at the pituitary gland. The pituitary gland is important in releasing hormones known as luteinizing hormone and follicle stimulating hormone that enacts at the gonads of the individual to produce the secondary sexual characteristics. And you'll be able to refer to your handout. Those are some of the typical male sexual characteristics of facial hair growth, deepening voice, enlarged genitalia, and then the female sex characteristics of breast development and pubic hair growth as well. In puberty blockade, using the medications such as Lupron, I've also included a table of some of the side effects that individuals who are treated with this hormone this blocker can experience. And so you can see on the male side, there is stunting of penile and testicular growth, on down to disruption of normal brain development. I invite you to reference that table that's included. In in female patients, they may experience the blockade of normal breast development, decreased blood flow to the external female genitalia, and they also sometimes will have disruption of normal development of psychosocial development as well. The next phase of treatment that individuals may experience is the cross-sex hormones. So basically, this would be taking a biological male, and providing to him hormones most typical in the female, so estrogen, for example. The other side would be taking a biological female and providing hormones such as testosterone. And I've also included a table for you that you can see some of the documented medical side effects that can happen when these hormones are used. So for example, estrogen exposure in males can lead to increased myocardial infarction, cardiovascular disease, increased risk of stroke, increased risk of breast cancer, and even prostate cancer. And then on the female, when they're exposed to testosterone, they also have increased of cardiovascular events, hypertension, as well as breast, uterine, and ovarian cancers. One of the things that I'd like to point out is that oftentimes when females are provided, especially the testosterone, it's actually in levels that are many times higher than physiologic, so 10 to 40 times higher than what we would experience those physiologic levels. And so for any of you who are familiar, I've included a diagnosis called PCOS, in which that's where females often experience increased androgens and have distress in their body from that. And you can see that this hormone level is much higher. And so in closing, the last part would be gender reassignment surgery. And there is a handout that has descriptions of kind of both of those in males and females. But what I would like to point out is in a study that was performed in Sweden in 2011, that was published in 2011, you can see that all-cause morbidity and mortality, or all-cause of death for individuals who underwent gender reassignment was much higher than their cohorts who did not in this study. And so some of that will be suicide risk. Some of that will be other psychosocial things that are involved. But there's a large question about how much of this is actually related to hormone supplementation and some of the procedures that these patients undergo. I'm going to yield my time there. I do have some more information, but I'll be glad to take questions if you guys desire when completed.
Colleagues, I'll hold, if we could hold for questions for just a minute. I'd like for Billy to talk for just a second. He's taken some time off from the Air Force Base in California to come out here. Billy, if you could take just a few minutes and talk about your story.
I will. Thank you, committee, for the opportunity to speak. My name is Billy Burleigh, and I used to be transgender. As a child, I had the reoccurring thought that God made a mistake. I'm a girl. I prayed before going to bed, and every time I prayed, I asked, God, please make me a girl before I wake up. If I could have, I would have quickly chosen any path to have transitioned me to female when I was young. A few years after passing the age of responsibility, I sought help for the disconnect between my mind telling me I was a woman, my body telling me I was a man. In seeking help and doing my own extensive medical research, the message I received was that I had to change my body to match my mind. After seeking any other path forward, I decided to take the therapist and medical researchers' advice to change my body. I started on testosterone blocker and estrogen. My emotions were up and down, and my body was changing, but I was supposedly on this new road to happiness, and that made me happy. In my first surgery, I had a penile inversion, an Adam's apple shave, and a brow shave. After the surgery, the doctor and the nurses had difficulty stopping the bleeding from my new vagina. My artificial vagina was packed with gauze, and a sandbag was placed on my lower abdomen, but the bleeding did not stop. Later, my mom, who accompanied me, and my aunt, they shared with me that going into my hospital room was awful. The odor in the room was like that of an overly saturated tampon. I received a blood transfusion and plasma, and eventually the bleeding did stop. My 2-week stay in the hospital turned into a 3-week stay, but changing my penis to an artificial vagina required 2 surgeries. So about 4 months later, I was back for part 2. My money was low at that point, so I didn't have any family or friends accompany me. I went through the second surgery on my own. After this, I had additional feminization surgeries. But no matter how many I had, every time I looked in the mirror, I saw a man staring back at me. I tried hard to resolve the conflict between my mind and my body, but after 7 years of trying, I had more problems at that point than I had when I started on the road of transition. The bottom line is that the therapists and the medical researchers were wrong. Changing my body did not resolve the internal conflict, and it did not make me happy. But what it did do was drain my financial resources and left me with a scarred body. I have fully transitioned back to male. I am happily married. I have 2 stepdaughters, beautiful stepdaughters, and I have peace of mind and body. Lastly, I was past the age of responsibility and made a horrible mistake. In hindsight, I am male, and I was born into the right body. The therapists and the medical researchers failed to help me with my underlying problems. They identified me as transgender, and they were wrong. How often are they wrong? I thank you for your time and for hearing my testimony.
Thank you for your comments.
Colleagues, I don't know how much more powerful you can state the issue. We have one more doctor here that's a pediatric doctor, and I would like to give him a chance to speak for just a moment. I'll yield.
Please introduce yourself and who you represent.
I'm Grady Crosland, and although I am the campus advisor of the Christian Medical and Dental Association at UAMS, I am not here representing them. I'm also the Arkansas State American Academy of Ethics in Madison, and I'm not representing them at this point. The 2 things that I would add is you have to be 18 years of age in this state to get a tattoo without your parents' permission. You have to be 21 to buy alcohol. To allow children to undergo these types of decisions at such an early age is a mistake. As Robin mentioned, I am a board-certified pediatrician. I also did a fellowship in adolescent medicine. I had a practice in Dallas limited to adolescents for 2 years. I also have 5 children, and 13th grandchild is due Thursday. So I am invested in this particular topic. As Dr. Wagner mentioned, it has really been an explosion of adolescents with this acute onset dysphoria. And this term, dysphoria, just entered the contemporary vernacular just in the last decade or so. In 2013 until May, the diagnosis was gender identity disorder. And I think we accommodated the current culture with the change. There were some letters of opposition that were shown to me saying that this is medically necessary and that we're taking that away. It's not medically necessary. Insulin is medically necessary to a diabetic, but these treatments are not medically necessary. They say that there are references to other bills about schools and sports. That's not part of this bill. Don't be confused with that situation. And this is not about children with ambiguous genitalia. That's not the concern. Another concern was, have we abrogated a parent's right to make the wishes that are in the best interest of their child? As a pediatric anesthesiologist, I give blood transfusions to children of Jehovah's Witnesses when it's absolutely necessary to preserve the life. So the state does put limits and best interest of the child. And there's a question about, am I using my religious beliefs in this? This is about the science. There is nothing in the bill that appeals to any religious stand to anchor this bill. And you will hear anecdotal events from people saying how important it was to have all of this. Anecdotes do bring out your emotion, but I'm really trying to focus on the best evidence-based medicine as I look at this and the science that gets there. And one person complained about what about the state legislating what a physician can and cannot do. The state has done that forever. I cannot kill you by an act of euthanasia in this state without being charged with murder. There are lots of things that I can't do that are legislated by the state for the safety of your constituents and my patients. And we can go back 2,500 years ago as I look at these ideas of how we should treat people. Hippocrates said it, primum non nocere, first do no harm. And thank you for your attention.
Thank you for your comments.
Colleagues, I'll open it up for questions.
All right, Representative Bentley, you're recognized for a question.
Thank you all so much for being here today. I cannot think of a more important topic, and my heart just breaks as I hear the story. So I've got a couple questions, if that's okay, Chairman. First, Billy, can you tell us what would have been better for you to have at that point? Can you tell us what would have been a better path? What would you had hoped the therapist had done for you at that point?
You know, I wish they would have dove deeper. They didn't dive deep enough into my problems. I identified myself as a girl, and they heard that. I'm 53 years old. I spent about 10 years of my life on and off, but 10 years total in and going through therapy. I had deeper issues. Not too long ago, I heard somebody mention that we are all seeking, that I am seeking acceptance, significance, and security. And in hearing this, I reflected back on how have I been seeking those things, acceptance, significance, security. And as a kid, I had a lot of problems. I was skinny as a rail. I had a speech impediment. I had learning troubles. I was uncoordinated, so when it came time to playing with the other boys, I was always chose last or not at all. I like playing with the girls. In my mind, in reflecting back in my mind, I could see how those problems contributed to my false thought of I'm a girl. I wish therapists would have dove deeper and identified these issues and helped me with those issues, then the encouragement to change my body to match my mind.
Thank you very much. Can I ask one more question?
Yeah, you're recognized.
So either one of the physicians, I'm just floored by the effects of the hormone blockers and they giving the excessive hormones. So you can clarify for me that these are the results that are happening when we do these hormones, the ones that were shared. The pediatrician is there, so these are well documented real results of these hormones.
Hormones affect every tissue in the body. They affect the liver, they affect the heart, they affect the sexual organs, the brain. They're ubiquitous. And claims that they are essentially safe and reversible are false. They're just flat out false.
Thank you. So without a doubt, you would say that it does harm when you're
Yes.
giving these.
And if I can lend to your first question, if you do nothing for children who present with this dysphoria, as Dr. Wagner said, with 10 to 12 studies, the average is 85% will align themselves with their biological sex by later teenage years. So you're giving me this cure that Billy has just described horrifically, and I can get a cure rate of 85% if I do nothing. And that's considered expectant therapy. If you do a reparative therapy with current, not the psychiatric therapy that we had 20 and 30 years ago, but if you have reparative therapy at this point, you can even expect things to be better. The issue, sadly, is so many parents and children are all only being offered what is termed affirmative or affirmation therapy. And it says, basically, you have to take the prepubertal blockers. You have to take the cross-sex hormones. And that, to me, is an impingement on informed consent. If you don't provide reparative therapy, expectant therapy, and affirmation therapy, all three, with the risk and benefits, then you have abrogated your responsibility as a physician.
Thank you.
Representative Gonzalez, you're recognized for a question.
Thank you, Mr. Chair. I guess any of y'all could answer this question. Is there anything in this bill that would prevent a pediatrician from treating a child with gender dysphoria?
Um,
And
They
I'm talking
could-
about providing any type of treatment, refer to counseling, I mean, anything like that. Is there anything in here that would prevent a pediatrician from
Yeah, you're welcome to.
treating a child?
Excuse me. There is nothing that what it prevents is the term is transition, so it's surgical or chemical interventions. It certainly doesn't prevent counseling. It doesn't prevent conversations. There's actually a list in the definitions of the exceptions of the things that you can do, because there are ambiguous genitalia, intersex conditions. There are things that happen. There are disorders of sexual development that are related, but are more physical rather than mental. And certainly, this has been very carefully crafted to make sure that doctors can treat real physical issues. But what it does stop short of is allowing professionals to chemically and surgically transition a child.
Okay, thank you. So answer is the only thing it prevents them from doing is assisting with the transition. So they can treat them in any other manner,
Yes.
basically. Thank you.
Thank you. I was searching for the word counseling and couldn't come up with it. Long day.
Representative Cloud, you're recognized for a question.
Thank you, Mr. Chairman, and thank y'all for being here. To piggyback off of here we go. Representative Gonzalez's question for the physicians. I assume that since you've come and given your time and expertise that you've read this bill. Is that assumption correct? Okay, so my question is in any way does this bill prevent medically necessary treatment to a child or any type of essential medical services for that child? Thank you.
I'm happy to answer that. I would say that in no way does this bill prohibit medical necessity or essential treatment to the child. As Mr. Gonzalez asked, I think compassionate care, referral for counseling, addressing the mental health concerns, all of those things would be something that that myself as a physician who cares for these children would do every day and with every patient. The only thing it limits is that transition. And essential care would be providing for their development, their growth, their nutrition, but then also referring for that support of the psychosocial support as well. As has been referenced, oftentimes the mental health concern is cited as a reason that these treatments are necessary. But even as recently as last year in the American Academy of Pediatrics Journal of Pediatrics, children receiving puberty blockers were twice as likely to have had a suicide attempt in the last 12 months. So we know that these children and these patients and these adolescents are still struggling, and they deserve the best care to address that.
As pediatricians, Dr. Wagner pointed out, we are compassionate toward all of our patients, and we are for social justice. We are against bullying of these children. We are against discrimination against these children, and we will provide excellent medical care when they're under our care.
Representative Boyd, you're recognized for a question.
Thank you, Mr. Chair. So, Representative Lundstrum, I think I have one quick question, just for a little clarity. There are obviously some things in the bill that the medical board couldn't regulate, but I guess my question is the things that are medical procedures, the referrals, there's always evolution in medicine. Are we the appropriate body to put this in statute, or should this be something really we should say, hey, medical board, go write rules? That's my only question. Thank you.
No, I think we are the appropriate body. We set rules and regulations all the time, and we set parameters all the time, whether it's nurse anesthetists or medical issues. We bring them in for this committee or the Senate Public Health. We state what we can and can't do about a lot of different things, whether it's what drugs you can purchase over the counter on alcohol or medications, or what Dr. McGee's presented today, or anything that we present in front of the legislature. This rises to that level. Kids in Arkansas need protection, and this rises to that level.
Representative Ferguson, you're recognized for a question.
Thank you, Mr. Chair. I have a question for the two doctors. How many patients have you all actually treated with gender dysphoria?
I'm going to let Dr. Wagner address that primarily. My adolescent medicine practice was in the late 1970s, and it's a very, very rare childhood incidence. It is 0.005% to 0.15% in males, and a third of that in females. So it's a rare occurrence. If you look at Arkansas's population, if we're looking at childhood dysphoria, you would expect only 20 to 60 males to be affected and less than a dozen females to be affected. So, and since I have been primarily doing anesthesia for the last 20 to 30 years, I have not taken care of those patients. I did do 10 years of craniofacial work, so I know about working with children who have different images of themselves and what's appropriate to correct those.
So the answer is 0. You've never treated a child with gender dysphoria?
To be honest, I had enough different patients in my private office. I cannot tell you whether I did or didn't. I had ambiguous genitalia, I had different chromosomes, and I can't tell you if I remember specifically having one with gender dysphoria. It would not be a surprise if I did.
Representative Ferguson, I have been in private practice for 7 years in Fort Smith. Most of the children that I have interacted with and adolescents are in that gender incongruence zone. A lot of them have not had dysphoria. I think in my past 7 years, I've had 2 to 3 that I have referred for psychiatric counseling or to counselors who I would think met the criteria for dysphoria. I've not been involved in any who were treated with hormones.
And it's my understanding there's no gender reassignment surgery done on youth in Arkansas anyway. Is that true?
No, there is not any surgery done on youth in Arkansas. I'm thankful for that, and hopefully this will draw that line in the sand before it happens.
I mean, are we a solution looking for a problem?
No, I don't think so at all. Other states are starting to do this and starting to mutilate children, and I think we need to stop it before it starts. We should never have penises amputated or breasts amputated on children, ever.
All right, committee, any other questions? Seeing none, thank you all for your comments. We have a number of people signed up to speak against the bill. We had 4, but the 4 people that are signed up to speak for the bill have already talked. So the first person on the list is Brandi Evans.
Can I make a motion, Chairman, before we get started?
What's your motion?
I'd just like to make a motion to limit debate to 2 minutes per person. We have a lot of bills in this committee that we'd like to get through, so.
That's a valid motion. Any discussion on the motion? Representative Allen?
Yes. I understand that we do have a lot of people, to speak against the bill, a lot of bills, but I don't think this is fair to the people that want to speak against the bill to limit their time when we have sat here for the last 45 minutes and listened to those who are in favor of the bill.
Representative Allen, I understand that. We have 16 people. If they speak 2 minutes apiece, that'll be about equal to what these other four have talked.
But those 16 people were on the agenda when it started. I think that if we're going to be fair with this, we should have limited it at the beginning and not at the end when we have people that want to speak against it. All I'm just saying is that we need to be fair with this. But if you want to make a motion.
2 minutes.
We have a motion on the floor. Do you want to make a substitute motion?
Our substitute motion is limited to 5 minutes.
Per person?
Per person.
Okay. Motion is, yeah. The motion, the substitute motion is to limit 5 minutes per person. Any discussion? Point of order, you're right. Thank you. All right, motion is 5 minutes per person. Limit debate to 5 minutes per person. All in favor, signify by saying aye.
Aye.
All opposed, nay? No. All right, we'll go back to the original motion. That motion failed. The original motion was 2 minutes. Limit debate to 2 minutes. There is no discussion. All in favor, signify by saying aye. Aye. All opposed, nay?
No.
Ayes have it, motion carries. Limited 2 minutes per person. You're recognized. Please introduce yourself and who you represent.
My name is Brandi Evans. I'm a parent of a transgender child here in Arkansas that does receive hormone therapy. I'm here to testify against HB1570. If this bill is passed, it could kill my son. When I told him about this bill, he literally said he would kill himself if this bill passed. The reason why is because he would not be able to receive his testosterone and it would make his body resume his period. This makes him depressed and to the point of suicide. When he was put on testosterone, his anxiety and depression disappeared. He is now able to live normal, happy life as his authentic self. You will be taking that away from him and will cause him his inevitable death. This would be the case with a lot of transgender children you are putting in the same position. Suicide rates will go up within this community as a whole. If this bill is passed, it is quite literally going to kill children in the state and the state will have blood on its hands. I have pulled academic journals and that back up the claims that I am telling you about the suicide rates. It is not the job of the state to tell me what medical treatments I can allow my child to receive. This is a slippery slope to tie parents' hands when it comes to medical treatment as a whole. What would be next? I also have an impact statement that I would like to read to you, but the main thing I would like to say is these are the children of the ones you could not kill. These are the children of the people who could not fly. These are the children of the ones who persevered, and these are the fearless that are strong and we are ready to carry on. So please vote no on this bill.
Thank you for your comments. Next person on the list is Courtney Frierson. Please introduce yourself and who you represent.
Thank you for the opportunity to speak. My name is Courtney Frierson. I'm an Arkansas resident. I am a licensed certified social worker, a mental health who's specializing in care for transgender clients, and I'm a sex therapist in training. I have about a 10-minute speech prepared, so forgive me for speaking quickly. I adamantly oppose House Bill 1570 because, in my professional opinion, it is based on incomplete and false information. It further stigmatizes and damages already vulnerable population. And if made into law, it would criminalize life-saving health care for trans youth. On page 2, line 2 through 6, the bill states the studies consistently demonstrate the majority come to identify with their biological sex in adolescence. A 2010 study in the Journal of Sexual Medicine following 70 adolescents who used hormone blockers, 100% of them continued on to use hormone replacement therapy and later gender-affirming surgery. The use of hormone blockers is considered fully reversible. They not only buy time for the child and family to adjust to the changes in the body and society and the school, They also halt development of secondary sex characteristics like body hair, menstruation, deepening voice, breast development that exacerbate dysphoria and make later gender-affirming care more difficult. On page 2, line 7, the bill claims trans children have already experienced psychopathology, yet there is no distinction between coexisting diagnoses and pre-existing diagnoses. A 2011 qualitative study in the Journal of Clinical Psychology finds that the vast majority of adolescents with gender dysphoria are not diagnosed with severe psychiatric illness. The bill correctly states there's a dearth of empirical research about trans people. We should be curious about that lack of research. When a message is sent that a group of people is insignificant, does not
15
matter,
seconds.
and is controversial, it has a chilling effect on research and hospitals. Finally, I'd like to say, paraphrasing from ALOC, when you consistently hear that you don't matter and you don't exist, sooner or later you come to believe that. I'll finally say my entire 10-minute speech is emailed to each of you, so I appreciate it if you would like to read it. Again, my name is Courtney Frierson. I urge you to vote no on this bill. It does
Your
harm
time
rather
is
than
up.
protect.
Thank you for your comments. Cynthia Martinez. She in the waiting room. Also, Gary Wheeler, are you in the room? Wait just a minute. You're not up till next. I just want to make sure you're in the room. So. Please go to the table and introduce yourself and who you represent. Oh, I thought that was her. Gary Wheeler, if you want to go ahead and go to the table and introduce yourself and who you represent.
Thank you. My name is Gary Wheeler. I'm a physician. I represent the Arkansas Academy of Pediatrics chapter, has over 430 members. Our national organization has over 70,000 members. I want to point out that while you have heard a little bit of information today, I do want to thank you for your focus on the safety of children. We share that common ground. However, I think that because of misinformation, misunderstanding that you have received, you are considering a bill that, as other people have said, will dramatically harm children. I'm concerned about the issues Representative Allen has raised about representation and the issues that Representative Boyd has raised about whether this is the appropriate focus. I've been in academic medicine for many, many years, Children's Hospital at UAMS. There has never, it seems extraordinary that we would try to determine whether procedures should be done or not, which are medical procedures in this setting. We don't need to, because these issues have been settled already by the American Academy of Pediatrics, the American College of OB-GYN, the American Academy of Child Adolescent Psychiatrists, and many other groups who have signed documents literally within the last few days advocating that gender-affirming therapy be done, that it has a huge scientific support, and you'll hear more about that from Dr. Michele Hutchison shortly, who will testify as a physician taking care of these children specifically about these issues. So this is the wrong place to have this discussion, number one. Number two, the message of this bill will be harmful. We do know that children will
You have
experience
15 seconds.
I would ask you to vote no on this bill. I want the children of Arkansas to know that the American Academy stands with them in opposing this bill, which reduces their value. And I think that you should again support the physicians and others that will speak against the bill following. Thank you.
Thank you for your comments. Cynthia Martinez is not available. Okay, Janet McCarthy. Justin Sarlo, if he is not in the room, then get them from the waiting room as well.
He sent his statement with me, if I can speak again. Justin Seiler.
Yes.
He sent me his statement. But he's not here.
He can't give his time to someone else. Sorry. Janet Carthy. Okay, Kristen Sowell. Kirsten Sowell. If you would get Lance LeVar as well. Okay, wait just a minute. We got one ahead of you. Please go to the table and introduce yourself and who you're here to represent.
Hello, everyone. Thank you for letting me speak. I'm Kirsten Sowell, and I represent myself and the transgender children and teens of Arkansas. Thank you for allowing me to speak on this important matter. As a licensed clinical social worker in Arkansas, I have worked with several teens experiencing issues related to this bill. You can see that it makes me emotional because I've been there after suicide attempts for them. In my experience, the care for this bill would eliminate and be detrimental to them. The care that this bill would eliminate would be detrimental to them. As a mental health professional, I've seen the harmful consequences denying gender-affirming care. This bill only furthers harm for teens and absolutely does not accomplish the supposed goal to keep teens safe. A study shows that transgender teens are 56% more likely to have suicide ideation, and 31% of them report previous suicide attempts. I've worked with kids who have had multiple suicide attempts before they were able to get transgender care. Different ways, such as hanging, pills, guns up to their head. Gender-affirming care can decrease and does decrease these statistics. However, denying gender-affirming care only increases these numbers. This is why this bill cannot pass. To truly keep all of our teens safe, allowing access to gender-affirming care must continue. 3 kids in the last 3 years have died that I know of. They were not able to get gender-affirming care. I've seen a decrease in kids needing to go to the ER after suicide attempts.
You have
I've
15
seen
seconds.
a decrease in hospital admissions to acute hospitals. This bill also will save the state money if it's not passed to be able to get access to care that's preventative and not after death. Thank you.
Thank you for your comments. Lance LeVar. Could you get MD Hunter from the, wait, okay. Please introduce yourself and who you represent.
Sure, I am Lance LeVar. I represent myself and my niece May. So a couple weeks ago, there was a bill in this committee, and one of the discussions on that were 3 questions about a bill. The first question being, will it allow discrimination to any group? Let me define discrimination according to Merriam-Webster. Discrimination is the act, practice, or an instance of discriminating categorically rather than individually. This bill is categorical in its denial to transgender youth. It is not individual. I also will quote Brené Brown. It is hard to hate close up. I know the representatives here do not want to hate, so I changed that to it's hard to understand from a distance. You heard from medical professionals, one of which did not deal with youth over the last 50 years, and even that was so connected they can't even remember if any of them had issues with this. Another that maybe had a half a dozen. It's hard to understand from a distance. Utah worked on a thing like this, and I'm going to quote some statements from their governor, another great conservative state. These kids are just trying to stay alive. He said, I apologize for getting a little emotional, but when you spend time with these kids, it changes your hearts in important ways. And so I want to improve that message and see if we can find a better way to work together. If you have not sat and listened to transgender, then you don't understand. I remember when I discovered my nephew, I say he was my
15
niece.
seconds.
I had two options because that is new to me and blew my mind. I found a friend who understood to help me discern the difference between gender discongruence and dysphoria and the outcomes that come from that. Thank you very much, and I hope that you consider getting closer than further away.
Thank you for your comments. M.D. Hunter, please introduce yourself and who you represent.
My name is M.D. Hunter. I'm representing myself. I am a local gay black male and a drag artist who is an ally for the trans community. HB1570 is extremely dangerous and improperly researched and a step back for the state of Arkansas. The verbiage alone is disheartening and offensive, starting with the name of the bill and the use of the word experimentation. The statistics worded in HB 1570 are improperly researched, starting off with the very first one that states that the APA, American Psychiatric Association, says that the American population that experiences distress with their biological sex ranges between 0.005% to 0.014% in adult males and 0.002% to 0.003% in adult females. I can't seem to locate this statistic on the APA, but I can find this if you do a quick search on Google and it pops up for Wikipedia. We should not be basing our lives as our children off of a Wikipedia statistic. The APA actually finds long-term mental health benefits of gender-affirming health services for trans individuals and have spoken quite often against trans bans. They even have a guide for caring for trans and gender non-conforming individuals. The William Institute of School of Law in 2016 did a study and concluded that about 1.4 million people identify as transgender in the United States, and this number continues to grow. We had some men that came up here and spoke about the growing of trans individuals, but did not speak about how it's affecting them or affecting our community at all, and there's no negative effect. A study actually showed that there are negative health impacts from the lack of early support, and that 73% of trans women and 78% of trans men surveyed first identified gender dysphoria by the age of 7. The Child Mind Institute concluded that health complications are higher if you wait till after puberty. And because I only have 10 seconds left, this bill is extremely, extremely dangerous to our trans youth. We need to set aside our personal feelings about this and realize that these kids already are just pinned up against a wall. They grew up, they don't understand what's happening.
Your time is up.
And thank you so much.
Thank you for your comment. Michele Hutchison.
I'm going to pull this a little closer because I'm short. Hi, I'm Michele Rebecca Hutchison, M.D., Ph.D. I'm here to represent myself and the almost 200 transgender kids that I have taken care of right here in Little Rock, Arkansas over the last 3 years. I moved to this state with the express purpose of taking care of this vulnerable group of children. I am a board-certified pediatric endocrinologist, and I work with hormones every day. And by the way, one misconception I want to put very clear into your minds is this business about puberty blockers being dangerous. We've been using puberty blockers for 50 years on children with precocious puberty. I guarantee you, if one of you in this room had a 4-year-old daughter who was beginning to menstruate, you would want me to use a puberty blocker in that child, and that is what we do, because a 4-year-old should not menstruate. And there's copious numbers of publications showing that the use of puberty blockers in very young children for lengths of time of up to and over 10 years is safe. So please don't fall into that trap if somehow this is an unsafe medication. We use it, and it's FDA approved in children. We've been using it for years. Some other things that I want to try to clear up some misconceptions. Your representative who spoke earlier named the American College of Pediatricians as some sort of source of reliable information. That is not a reputable medical organization. It is actually listed as a hate group on most sites in this country. Number two, this idea that children show up and suddenly are transgender is just so absolutely false. I'm getting ready to publish a paper to cover that exact topic. In fact, by the time these children come to my care, they have known they were transgender for up to 8 to 13 years. The average is actually 8 years that they've been aware of their gender difference by the time they come to see me in clinic. This is not a phase. This is
15
not something they
seconds.
just dreamed up. And last thing, I don't know if it's going to be 1, 3, 6, or 12, but children will commit suicide after you pass this bill. That's a guarantee.
Thank you for your comments. Oh, I have a question. Representative
Of
Boyd.
course, I'm more than happy to help out.
Representative Boyd, you're recognized.
Thank you. Dr. Hutchison, correct?
Dr. Hutchison, yes.
Yes. Hey, thank you for being here today. Thank you for your testimony. I do have a quick question,
Sure.
though. So when you look at your referrals to your clinic, are they evenly distributed across the state? Do you have more of them just from Little Rock? Do you have, I mean, can you help me with your referral base?
It's an absolutely wonderful question, and I can tell you that we have not advertised this clinic. Most of our referrals actually come from word of mouth, hearing from other children and other families. We do have a few pediatricians who do refer to us, and the referral patterns have been surprisingly quite diverse. I have a lot of patients, for instance, in Jackson, up in the, in Pine Bluff, and coming from the northeast part of the state. I think that was a bit surprising. We have so many patients up in the Fayetteville area that we had to open a second clinic, and we travel to Fayetteville to accommodate the number of patients that are up there. It's surprisingly been every walk of life, every race, color, ethnicity, and socioeconomic status is represented. Thank you again.
Wait, I got another question. Representative Ferguson, you're recognized.
Yeah, I do have a question about the suppressing hormones. Why is that? Why do you choose to do that in a child instead of waiting till adulthood?
Yeah, I think that's a fantastic question. Well, obviously in our children with precocious puberty, we do it because we don't want them to be, menstruating at a young age. That's a separate issue. I'll be quite frank with you. We use very, very little puberty blockers in my practice because the children, by the time they come to us, are well into puberty. The average age of children starting on cross-sex hormones in my clinic is 17. We are not doing radical experimental things with these children. We are very patient, very slow-paced. We give these kids a lot of time. Nobody's in any hurry. In fact, I've a couple of times had to slow a couple of families down because I felt like they were pushing. Yeah, I want to answer specifically your question. The puberty blockers are to slow down the pacing of it's what we call secondary sexual characteristics. So, for example, a trans girl doesn't want to grow a beard, and a trans boy doesn't want to have breasts. And the puberty blockers give you time to slow that process down while you do intensive psychotherapy and psychiatric analysis and work with the child to make sure that this really is the right decision and to get to the point where the child is actually old enough to make that decision, because these are life-changing decisions and they cannot be done quickly. And so all we're trying to do is buy that child some time. That's all we're doing.
Representative Allen, you're recognized.
Thank you, Mr. Chairman. Doctor, how much of your time is spent with counseling with these kids?
Oh, that's a fantastic question. So we follow the protocols that are published by all reputable organizations like the American Academy of Pediatrics, for example. And intensive ongoing psychotherapy is absolutely required for each one of these children. In fact, I will tell you, if the child is not plugged in with a therapist for regular psychotherapy, they can see the door. We will not treat them. And I've come to blows with a couple of moms over that, I'll be honest, not fun. But intensive psychotherapy is absolutely required. And I will tell you, and I am proud of the fact that several of our kids have decided they are not trans. I consider that a win. I consider that a major victory. It means we're doing it right. And anyway, I just can't brag enough about how great the team is. But yes, intensive psychotherapy is absolutely required.
Thank you for your comments.
Mm-hmm. Thank you for listening. Thank you.
Rumba Yambu. Please come to the table, introduce yourself and who you represent.
Hello, my name is Rumba. I'm the director of Intransitive, a trans organization here in Little Rock. And I'm one of those people that crossed over, like they said. I'm transgender, and I don't know how counselors are in California for the person sitting here, but in Arkansas, they're wonderful. As you've heard, it takes a lot of time for you to be approved to be able to get on hormones, even if you're older, right? And clearly it's reversible. Otherwise, we would be calling this gentleman she instead of he. But aside from how terrible this bill is, I want to remind you that the U.S. Supreme Court has recognized time and time again parents' constitutional right to care, custody, and control of their children. Arkansas even has vaccine exemptions for religious and philosophical reasons. So you need to think about that in the way that this bill is worded, right? You cannot take away a parent's right. This is Arkansas. It's surprising that a group of Republicans would want the government to come in and just take away parental rights. Where is it going to go next? How is it going to affect Jehovah's Witnesses who don't even want to celebrate their kid's birthday? And have you been around a kid who doesn't get their birthday celebrated? Will then the government come in and say, you have to celebrate that kid's birthday? Where's it going to stop? We cannot open that door. This is a conservative state. We do that separation. Let the parents have the right to choose what they want for their children. Even the Bible tells us that good parents love their children and commend them, just as Jehovah God commended his son. And James 1:19 tells us, our Heavenly Father listens to his servants and he pays attention to their feelings. Parents do well to learn from him and listen to what the children have to say.
15 seconds.
These parents care. They sit and they listen in the same way that God sits and listens to us. And they make those decisions together. So do not take away a parental right to choose what they do with their children, how they raise their children, and how they love their children. Thank you.
Thank you for your comments. Man, sorry. Savannah Colson. Okay. Also, Willow Breshears. You would get them from the waiting room as well. Please introduce yourself and who you're representing.
My name is Savannah Colson, and I'm here as a private citizen representing myself. HB 1570, the so-called SAFE Act, is a bill that, if passed, will directly and immediately threaten the safety of trans youth in Arkansas. The World Professional Association of Transgender Health has clear guidelines in their standards of care, the treatment of all transgender people, including transgender adolescents. This bill zeroes in on physical interventions of essential gender-affirming care while completely ignoring all the mental and social aspects that are explored before these physical treatments are made. In fact, the WPATH states that before any physical interventions are considered for adolescents, extensive exploration of psychological, social, and family issues should be undertaken. No child, guardian, or medical professional ever jumps to medical interventions such as surgery or hormones as a first-line treatment for transgender adolescents. And no trans kids receive medical interventions without parental consent. Assuming as such only perpetuates the wholly undeserved stigma around trans youth and leads to problematic bills like this that cheat one of our most vulnerable groups of human beings out of life-saving care, all while setting a dangerous precedent for the rest of the country's youth. In a gender-affirmative care model, pediatric providers offer developmentally appropriate care that is oriented towards understanding and appreciating the youth's gender experience. Providers, youth, and their families follow the gender-affirmative care model, all work together in a partnership to destigmatize gender variance, promote the child's self-worth, organize access to various methods of care, and offer education to families, address complicated emotions, questions, concerns, and ultimately advocate for the community spaces that are actually safe for them. If one claims to care about the safety and well-being of children, that must include our trans youth as well. The SAFE Act not only fails to protect them, it actively harms them. Transgender children should be supported, nurtured, and cared for, whether in their homes, in their schools, Thank you.
Thank you for your comments. Willow Breshears. Please introduce yourself and who you represent. Wolfe, Villegas, you in the room? If you would get them from the waiting room, you may proceed.
My name is Willow Breshears. I am the founder of the Young Trans Women's Project and organizer at the Center for Artistic Revolution. Before I get into my testimony, I want everyone in this room to know that I am an out and proud transgender woman. I have had no hesitations about my gender, nor is my gender a mental illness. I have known I was a woman since being a child. I have been living in my truth for almost 6 years now. I am coming here today to ask you to vote no on HB 1570. This act implies that young transgender people are not actually trans and rather are mentally ill. This is not true and is not supported by hormone therapy replacement doctors and many other organizations, which I will not name because I'm short on time. I have been on hormone replacement therapy since I was 13. I have had no harmful side effects from estradiol, spironolactone, or progesterone, the commonly used hormone replacement meds for transgender women. Having access to hormones was life-changing for me, and if I had not had access to that, I would probably not be alive today. This bill is extremely harmful for transgender kids, and hormones are absolutely medically necessary. The stats show that. The stats show that they lower suicide rates. It's already extremely difficult to get on hormones when you are under 18. It makes it even more difficult, and most trans people have trauma surrounding healthcare. When I was 16, I was already scared of doctors and hospitals because I had been treated badly in healthcare settings because I was trans. I hid an illness from my mom for several days before finally going to the ER, and even though she worked in that ER, I was still made to feel uncomfortable by doctors. Healthcare is a human right, so it is beyond me that any legislator would legalize discriminating healthcare, especially for children, because bottom line, these are children. Arkansas senators for the bill frame it as if it is merely
15
elective
seconds.
procedures that will be restricted. I'm going to end with this. Transgender people are beautiful. Transgender people are powerful. Transgender people are sacred. And in the words of Ms. Major, we're still here. And I ask you to vote no on this bill. Does anyone have any questions?
Thank you for your comments. Wolfe, Villegas. Please go to the table and introduce yourself and who you represent.
Hi, I'm Wolfe Espinosa Villegas. I represent myself in the trans community. And I'm a trans person who needs trans-informed healthcare. Today, I'm here to cut through the manipulator's veil and reveal the bones of this monstrous bill. I'll point my finger at you and call this what it truly is. It is propaganda, fear-mongering, and oppression. This bill will cause human beings, trans beings, children's death. All this bill serves is to create anxiety out of a problem that doesn't exist. It's incredibly difficult already for adolescents under 18 to access this type of healthcare and requires parental consent already, which renders this bill absolutely unnecessary. This rips away our freedom to choose what is best for us, limits the liberty of children and their parents, as well as undermines medical professionals alike. Even the very name of this bill is intentionally misleading. I can promise you that if a supportive process had been the norm when I was a child instead of this outdated rhetoric, the scars of attempted suicide will not adorn my body to this day. The trauma wouldn't live in my bones that I work to overcome to this day. 39% of trans kids attempt suicide, more than twice as likely to attempt suicide as cisgender heterosexual children. I am part of that 39%. Some trans kids were not so lucky as I, and I hope that they finally found that peace that legislators who support this bill so brutally, inhumanely snatched away from them with these kinds of bills. So I beseech you to please vote against this murderous bill. The options for trans-affirming healthcare should principally always be left to the people themselves and not legislators. There are hundreds of studies, such as the one conducted by the Rady Children's Hospital Clinic in San Diego, California, finding that there is a high need for treatment of transgender youth. 62% of the trans youth in this study reported feelings of depression and anxiety, with some even having self-cutting and harming history. The study found that mental health significantly improved once allowed access to this life-saving healthcare that includes experienced endocrinologists, therapists, psychiatrists, primary care providers, and surgeons. If you would just call your bill what it is, oppression, then perhaps I would actually be able to finally say something good about you. At least I could say you were honest.
Thank you for your comments. Holly Dickson. Please introduce yourself and who you represent.
Good afternoon. My name is Holly Dickson. I'm the Executive Director for the ACLU of Arkansas.
You may proceed.
Thank you. On behalf of the ACLU of Arkansas and all of our members, we strongly oppose this bill. This bill, as you have heard, will harm transgender youth who are already one of the most vulnerable and marginalized populations that we have in this state and in this nation. The bill runs contrary to the advice of the medical care providers you've heard from, who care for these kids and provide care to these kids. The bill is unconstitutional. It takes away the rights of parents in conjunction with their children and their medical care providers to make individualized, personal, private medical decisions on a case-by-case basis. It's dangerous. We ask that you please listen to those who have spoken on behalf of their children, on behalf of their patients, and most importantly, trans youth themselves. Uphold the Constitution. Reconsider your support for this bill if you're a sponsor, and please vote no. Thank you.
Thank you for your comments. Chris Attig. Please introduce yourself and who you represent.
My name is Chris Attig. I'm a father in Arkansas, not a lawyer in California. Before I speak to the committee, I would like to address the transgender youth of the state of Arkansas as a real father does, a real father of a transgender child. No matter what happens here today, no matter what happens here today, you are loved. You are loved. No matter what happens today, we will prevail over this injustice. I come here today knowing full well that nothing I say will persuade this committee. You're hell-bent on passing this bill and running it through the rest of the legislature. You know that this bill is unconstitutional and will not survive federal courts. The Supreme Court has already found that transgender Americans are protected from discrimination. Justice Neil Gorsuch, joined by 5 Supreme Court justices who still sit on the court, that's 6, that's a majority, wrote that it's impossible to discriminate against a person for being transgender without discriminating based on sex. And discrimination based on sex violates our U.S. Constitution. You know this bill will further stagnate our state's economy. Diversity and inclusion are good for business. Discrimination imposes enormous productivity costs and exerts undue burdens. No economy in the history of the world has flourished under policies of hatred. Business will leave this state. New business will not come to this state. Remember North Carolina? As a business owner who pays tens of thousands of dollars in taxes to this state and who employs transgender workers, I am offended that you would squander our limited taxpayer resources paying lawyers to defend this infantile nonsense in federal court. Many of you claim to live according to the Bible and your Christian religion. So you have certainly read Romans 16:33, in which Paul asks, who knows the mind of the Lord? Those of you who would pass this bill into the full House claim to know the mind of God. There are more genders than you are aware of. There are more biological sex than you are aware of. You do not know the mind of God. I sit before you as a father.
Your time is
Every
up.
constituent who votes or who will vote
Your
is a
time is
parent or a
up.
child. Every person affected by this bill.
Your time is up. Would you move him from one table?
Making health decisions for our families and our children. Something very important to me who I love is unconditionally.
You had 2 minutes, like everyone else. Your time is up, sir. Thank you for your comments. Would you get Carmen Grisham? Carmen Grisham from the waiting room.
You are loved. We will prevail against unrelaxed as I can be. You are loved. We will prevail against this injustice.
Please go to the table, introduce yourself and who you represent.
Can you hear me now? Okay. I'm Carmen Angelica. I am here to represent myself and other transgender people that I know. I first actually want to address the representative with blonde fried hair. My vagina is not a mutilation, and neither is any other gender affirmed or created vagina. So I think when they use language like this, it's very clear that they aren't relying on the science or the backing of any literature. And furthermore, as someone who's studying for her bachelor's of science in nursing and is about to be a registered nurse in May, it is embarrassing to be licensed under a state that is possibly going to legalize discrimination. And to add more, one of the core components of nursing is evidence-based practice, and the evidence is clear. Providing hormone replacement therapy is one of the best preventative actions against dysphoria for transgender children. Any major association, including the American Medical Association, the American Nursing Association, and the American Psychological Association that agree discriminating against transgender healthcare isn't best practice. But it's clear that not everyone here has done their homework. I had to pay out of my own pocket to make up for all the things that testosterone had done to my body, because I had a provider when I was a child who would not listen to me when I needed my hormones. I was 15 and I remember it clearly. I'm sorry for Billy or whatever his name is, but that is not the story for most transgender people. Most transgender people, when they transition early, lead a very happy life. And I've had to pay again out of my own pocket. I don't expect any of y'all to be paying for the children who, if this bill goes through, who will have to go through the suffering of
15
dysphoria.
seconds.
And go through it. I want to thank you for listening to me, and I hope you vote against this. And I also want to say it's kind of ridiculous that you allowed those people to speak for so long, and you're only giving us each 2 minutes. So congratulations on that.
Thank you for your comments. X Fresh. Please introduce yourself and who you represent.
It's X Freelon. My pronouns are they, them. I'm actually an agender and non-binary identifying person. I work as the executive director of Lucy's Place. It's the only operating homeless shelter in the state of Arkansas that addresses homelessness as a crisis and as an epidemic within trans and queer communities. Continuing, I'm sorry, this is stuck. Actually, I don't mind. Continuing off of where actually my employee Carmen ended, I do find it quite a shame that you have reduced the amount of time of your community members to speak to 2 minutes, but you allow people from outside of the state to take up 35 minutes and more of your time. I'm going to continue and not rest there, though. I have one claim that I decided to make, or one specification for the healthcare provider who falsely attempted to offer their expertise from UAMS, yet have not cared for a trans person in their time at UAMS, unnamed. Caring for trans youth when they enter hospitals after suffering attacks is not compassionate care. It's negligent. In the last year, I responded to over 10 calls of incidents where there was someone lying in a site of violence. I've only worked in my position for 8 months. I moved here a year ago, and I have already experienced more than 5 youth that have attempted to take their life just calling the organization I work on behalf of. And we are centered in Little Rock. These calls came from Fayetteville, they came from Missouri, they came from Ohio, they came from Oregon. It's needless to say, it's wishful thinking for me to have hope that we as a society could have protected Brayla Stone, who was a trans girl who was murdered in Little Rock, Arkansas last year. It actually has not been
You
a
have
complete
15
year.
seconds.
Thank you. I hope it's not too wishful of me to believe that we can protect children like Willow and like Carmen, who are here and able to speak for themselves, and maybe think proactively about the children like Brayla, who no longer are here and cannot speak for themselves due to lethal transphobic violence. She was murdered, and there was not an answer for her murder.
Your time is
I'm
up.
asking you to think proactively and not reactively. I'm asking you to think about me in my position. And I'm asking you to care for the people who work on behalf of your community,
Your
to
time is
care
up.
for people who would otherwise be neglected
Your time
by...
is up. All right, committee, that's everyone that has signed up to speak against the bill. Let the record show that more than 40 minutes was given to the people who oppose this bill. that was more than equal to the people who spoke for the bill. All right, no one else has signed up. Representative, are you ready to close for your bill? You're recognized.
Thank you, colleagues. I know it's been a long evening, and I want to thank you for your time. I want to first address one of the things that people have said, that parents, first of all, we do dictate quite a few things as parents that we have to follow the laws. First of all, we can't even take your baby home from the hospital without having a car seat. We don't allow people under 18 to have alcohol, tattooing, drive, certain drugs, smoke, go into a casino, rent a vehicle, purchase cigarettes, buy a lottery ticket, rent a hotel room, open a bank account, buy real estate, look at porn, vote, rent an apartment, sign themselves out of school, buy medications such as cough syrup. This bill, while it's been labeled a lot of things, it does see these children. They are valuable. They're precious. They're incredibly precious. It sees them as incredibly precious. That's why it's important to protect these children, because you can't go back. They are incredibly vulnerable. That's why we need to run a bill like this. They can make these decisions when they're over 18 and they're adults, and they can think about what the decisions that they want to make, and they're capable of making those decisions. But the first rule of medicine is do no harm. They can get counseling. This doesn't stop counseling from occurring. But it does stop the hormone puberty from happening, those puberty blockers from happening. It does stop surgery from happening on a child. A child. There's no reason to do that to a child. Puberty blockers on a child. Those are things that we don't need to do. This doesn't stop counseling. I think one of the quotes that I read in research was quite interesting. It said, "This could be the greatest scandal in medical history." Can you imagine what some of these children may, in 10 years from now, they talk about suicide? That's real. That is real. These kids need real health care. They are truly vulnerable, and we see them. This bill sends that message that we do see you. That's something that needs to come out of this conversation. They're precious, and they're valuable, and I want you to remember that. I think at the end of the day, one of the things that I think is most important is not the titles that we have or the money we make or the buildings that we might build or the great things that people might do, but we're judged by the actions that we take to protect the innocent that can do nothing for us, but we should protect them. And Arkansas's children are worth protecting. This bill does that. And with that, I would ask for a good vote.
What's the will of the committee? Representative Bentley, you're recognized.
I make a motion to pass.
I have a motion to pass. Any discussion on the motion? Representative Ferguson, you're recognized.
I know this is hard, and I would almost guarantee that none of you in this room on this committee have ever had a friend who was transgender and really understand the ramifications and what they go through. The way I read this bill, a primary care physician could not even refer for specialty care of any type, psychological or any other thing. You listen to all the Arkansas physicians and people who treat these people in Arkansas, and they have all told you this is a bad bill. You need to lead this to parents and the medical community to decide what's in the best interest of these children. That doesn't mean, there's no gender reassignment surgery done on children already. We know that. And they're not always given hormones. That's the decision with the medical community. You all know as well as I do, this is driven by an outside lobbying group, that it's no longer favorable to discriminate against blacks and gays anymore, so they pick transgenders for this session. Ultimately, this bill is intended to make life more miserable and discriminate against a tiny minority of kids. I beg you to vote no on this.
I'd like to address that. That is simply not true.
You're not on the committee.
Any other discussion?
I'll have discussion, Chairman.
Yes, you're recognized.
I would just say that the heart of this bill is people here in this state that want to protect children. To think that we want to give hormones that would make a child infertile, and to know that 85% of those kids, if they had given right psychiatric care, would reverse that decision. How dare we think we can give this dangerous medications to children and think it's safe? I would say that we can treat kids. We love kids. This is about love, and it's about loving children. This is exactly what this bill is about, and I'm definitely going to vote for it. Thank you for bringing it forward, Representative Lundstrum.
Any further discussion? Okay, the motion on the floor is do pass. All in favor signify by saying aye. Aye. Those opposed say nay. No. The ayes have it. Congratulations, your bill is passed.
Thank you, colleagues.
We have two hands. Okay, have a roll call.
Representative Cloud. Yes. Representative Davis. Yes. Was that a no?
Yes. Yes.
Representative Perry. No. Yes.
It was a no.
No, I'm sorry. Representative Penzo.
Yes. Yes.
Representative Wing.
Yes. Yes.
Representative Pilkington. Representative Pilkington. Representative Coleman.
Yes. Yes.
Representative Allen.
No. No.
Representative Boyd.
Yes.
Yes. Representative Gonzalez.
Yes.
Yes. Representative Gray.
Yes.
Representative Bentley.
Yes.
Representative Payton.
Yes.
Representative Miller. Representative Miller. Representative Dodson.
Yes.
Representative McGee.
No.
Representative Eubanks.
Yes.
Yes. Yeah. Representative Wardlaw. Yes.
Yes.
To pass.
Representative, your bill is passed. Thank you.